We are at Florida Atlantic University, a beautiful campus actually, and Phyllis and Harvey Sandler, their School of Social Work, is partnering with Delray Beach Drug Task Force, there it is again, to present SUD talks, reflecting this school's mission to maximize human potential, alleviating human suffering, enhancing the vitality and caring capacity of communities, and through education, research, and community engagement, promoting excellent addiction treatments. They do good work here, and it's a beautiful campus. Reminds me where I went to school. It's a welcoming campus, and I did go to school. To tell us now about the cutting edge of addiction related to research being conducted here at FAU, we have 3 doctors. Wow. PhDs, I believe. Dr. Janet Robichaud, Dr. Wendy Costefero. We also welcome Dr. Heather Howard, who's joining us via video presentation. She's currently doing research in Tijuana. You remember doing research in Tijuana, right? Well, actually, I don't remember doing research in Tijuana. Here's Dr. Heather Howard.
Good afternoon. My name is Heather Howard, and I'm an assistant professor at the Phyllis and Harvey Sandler School of Social Work. I want to thank you all for being here. Your voice is so important in addressing the opioid crisis, and I want to thank Dr. Luna for inviting me to speak today and to be included on this research panel. Unfortunately, I'm not here physically today because I am on a community service trip in Tijuana, Mexico. I'm working with an organization called International Network of Hearts, and their mission is to rescue boys and girls out of human sex trafficking. My area of clinical and research expertise is in maternal substance use. I have over 21 years of clinical experience with pregnant and postpartum women. And this population is so rewarding because it creates this incredible opportunity for positive change. My focus is women, and has been women with opioid use disorder, then who subsequently become pregnant. As many of you know, pregnancy is an extremely stressful time. It's a time where you begin to start thinking about choices, your family, what you would like your family to be, your health, how to care for a newborn, numerous questions. We'll add on this the addition of having an opioid use disorder and really having a lot of discrepancy in what you're hearing is best practice and what to do and what may happen. It could be overwhelming. So I really wanted to explore and investigate what is this decision-making experience for women who are pregnant and have opioid use disorder. And what was most significant in the findings, it was a qualitative health study with 20 women from the New England region, was the incredible experience of both internal stigma and external stigma. Pregnant women who have the substance use disorder are the most stigmatized group in our U.S. society. And this carries tremendous guilt and shame with the women that are trying to do the right thing. In addition to the stigma, there is these parallel fears. One is a fear that due to an opioid use disorder, and that may be initiated in a myriad of ways, whether it's prescribed opioids, heroin, medication-assisted treatment, irregardless, the substance exposure in utero, infants may develop NAS, neonatal abstinence syndrome. And this is a treatable syndrome. We have great practice in teams across the country to address it. However, the experience brings tremendous fear, guilt, shame, and it can be overwhelming. The parallel fear is the involvement with the child welfare system due to substance use. Like many states, Florida considers substance use and pregnancy child abuse, and hence an investigator from DCEF is usually contacted at delivery. The worst case scenario is an infant removal, and this was described to me in the data as it is like that your infant is being kidnapped, you're watching your child be kidnapped, and there's nothing that you can do about it. As a human being, I could relate to this. I could understand this phenomena. And I couldn't even imagine how people in recovery cope with that experience. So, hence what I also found was there were two outliers in the study, and they experienced something quite transformational, and that was support for their autonomy, support for their self-determination, support that they believed in these mothers that they could succeed. And one was a nurse that provided support, one was an OBGYN, but it can be a social worker, it can be a lay person, it could be you or me. And these participants that received support attributed to their engagement in treatment and not giving up. Pregnancy and parenting brings an incredible individual motivation and opportunity for positive change. And it's imperative that we create supportive environments for this population, that we advocate, we use non-stigmatic language. I'm really excited to continue in developing and implementing interventions that support pregnant parenting women and who are vulnerable and are experiencing interface with child welfare system. Currently, we're going to be getting a new research study with Dr. Wendy Gustafaro of the Criminal Justice Department, and we are looking at women that have lost custody of their infant and how this has impacted their recovery and what different strategies and practices we need to put in place to provide services, comprehensive services to for family preservation and allow mothers and infants to be a dyad and to be together in this process. Thank you so much for your time. Thank you for being here. And I look forward to continuing this work with you all.